Well, it's been a stressful year, to say the least, so far, and people talk about anxiety and depression, but what is it really? What are the signs you could be suffering with the condition, and how can your doctor help if you are? Dr. Frances Pitsilis joins us now to answer these questions. Good morning, Dr. Frances.
Good morning, Carly.
What are the statistics around anxiety and depression?
Well, about 5 years ago, our survey in New Zealand showed that 16.6% of Kiwis were diagnosed with depression and anxiety. But 3 to 4 years ago, it was more like 20%. So it's gone up. And it's a bit more common in women, and there's a small percentage in children, but it's more about behavioural problems for them. Worse in Maori and poor socioeconomic.
What exactly is anxiety? I can tell you how I experience it, but everyone experiences it differently.
Look, I think today we're talking about the anxiety that most people think about. You get tense, you worry, there's an associated physical response to what seems to be a threat or a fear. That's a good way to describe it in my view. You can get physical symptoms like sweating, muscle tension, palpitations, but there's actually a huge list of anxiety disorders that are more specific, that we could possibly do a different time. But we're talking about the general sort of everyday anxiety that people are getting.
And what about depression?
Oh yeah, now depression, in my view, I think anxiety, when it sort of starts to overwhelm you, it then leads to some depression. I think this is why they run together. Depression really is something that affects your mood, your thoughts, your body. And the official diagnosis of depression is that you've got to have 5 out of 8 conditions. You've got to have a depressed mood, reduced interest or pleasure in anything in life, a big weight change or appetite change when you're not trying to diet, you start slowing down, fatigue, can't think properly, can't decide, and one of the things is thinking of death, thinking of suicide. Now, these symptoms must not be related to a disease or some other disease.
So, who's more at risk of anxiety or depression? Because we hear about it more
Yeah,
and more.
it's definitely genetic. It runs in families. There are genes for all of these things, so you can't get away from that. You're wired to survive. You're wired to avoid things that are going to kill you and maim you. But these days, there's so much around. And then on top of that, any sort of major life event, any sort of situation where there's any loss of control, which we've had a lot of, fear for the future, financial, any major change in your life.
So, Dr. Frances, how can anxiety or depression start to manifest?
Yeah, now this is something that I think the viewer really needs to pick up on. I think that it creeps up on you, and you need to be aware of this. You start not sleeping properly. Maybe you can't stop thinking at night. People talk about a busy mind. Maybe you wake in the night and you can't get back to sleep, or maybe you wake early in the morning. Then you're tired. You can't get out of bed. You have poor energy after lunch, but you get a second wind at night. We call that wired and tired. You start then feeling anxious. You start finding that your mental function isn't so good, not able to work quite as well. You might want to start using drugs or alcohol to help you through. People come home and have a drink, don't they? You start to withdraw socially. You start to gain weight or lose it. You start feeling sad or crying. And then as you get worse, you start blaming yourself. You don't feel any hope for the future. And your physical symptoms that you might already have, like premenstrual syndrome or blood pressure, all of that gets worse.
What symptoms might you see in people at work? Because one of the things about anxiety and depression is that people think that they can do a pretty good job of hiding it.
Yes, well, it's really interesting because it's creeping up on you, but other people notice. And in fact, very often, someone will come along and say, "Are you all right?" Or one of your closest friends will say, do you think you might be depressed? Now, the symptoms are your behavior changes. People get angrier, they get cynical, they start bullying, they have low emotional reserve, they can't control themselves, and they might lash out and embarrass themselves. I mean, say something to the boss they wouldn't have normally said. You start to not want to go to work. You don't care about work. So people start not cooperating, staying home, not following instructions. Their performance goes off, anything like that.
Okay, Dr. Frances, how do you know if you're having an actual panic attack?
Right, now that can happen to people when they're very stressed and anxious, and they may not even know that they're stressed and anxious, but their body tells them. People have described to me that they suddenly feel like they're going to die, and they also have a sense of foreboding and fear. And what actually happens to their body is that they get short of breath and can't breathe. They get palpitations. They can get tingling in their hands, feet, or face, dizziness, abdominal pains, ringing in the ears, and other symptoms. Now, it can be very, very frightening, and you can end up in hospital. And it's this danger response that your body's doing.
Okay, so give us some hope, Dr. Frances. What treatment is available for anxiety and depression?
Well, it's quite similar for both. Some people might need some rest, some time off, or if they don't, they need to be careful about their work, and it's very tempting to overwork, but that's going to make it worse. The doctor is going to help you make sure that you can sleep, because sleep can become a nightmare for a lot of people with this problem. The antidepressant medication takes 2 to 5 weeks to work. So sometimes a tranquilizer for a short time to help you sleep can be a real godsend. Now, I can see an emerging role here for the CBD solution, which is very good for worry and stress. Now, talking therapy will be offered to you. Very, very good, very powerful. This is the counselling, helping you to navigate and see through how the way you think can change so that you can get better. Any sort of stress management, great diet, lots of vitamins and minerals, and the doctor can do some blood tests for you.
And just a little personal note out there to anybody watching and experiencing any of these things, you can get better. And these things do work. So what can a person do, Dr. Frances, if someone you love or work with is getting depressed?
I think with what we've all been through now, being aware of it, being aware that it may not be evident to your loved one or your friend or your workmate, and if it may not be you, but make sure they talk with someone that they feel comfortable with and trust, to breach the subject with them, and tell them kindly what they're seeing, and then get them to their family doctor, because that's the most important place to go at the first instance.
Wonderful advice. Thank you so much, Dr. Frances.
Pleasure.
And if you are concerned about anything we have discussed this morning, please do contact your own health professional.